Hi, Dr. Moin. A lot of rumors going around about this particular surgery.
The quality of outcome, the safety of the surgery increases. They are all called metabolic benefits.
Do you have to be a certain age to do it?
So many checklists we are doing in Manipal Hospital. Obesity is no exception for anyone, and many people have done that.
So, before we begin our today's podcast, let me introduce myself. I'm Parvati Nair, I'm an actress, and I'll be the host for today. Joining us is Dr. Moinuddin, Director of Bariatric and Metabolic Surgery of Manipal Hospital, South India. Today, let's explore expert insights on health, transformation, and sustainable weight management. Being an actor and from this industry, which is all about looking great, looking fit, and everything, I think a lot of rumors going around about this particular surgery. So, we would love to know the truth very, very honestly, candidly. We always hear that being fit, working hard is enough to look good, to look fit. So, however fat you are, if you really, really work hard enough, like work out in the gym, you can lose weight, is what they say. If that's the fact, then why are a lot of people who are working so hard still struggling to lose weight after years and years of gym workouts, following diets, and everything? So, there is something about it, right? Like we see all these reels which say, work out, this happened in so much time. But it really doesn't happen. I know people who try to follow it, and unfortunately, it doesn't work the same way after years of hard work as well. So let's start with that.
Okay. Thank you, Parvati. Thanks for having me. There are a lot of things around obesity which are myths. So
Okay.
today we are going to break myths one by one. So obesity is not controlled by individual person always. There are some things which are not under their control. But yeah, what is there in their control is what is going inside is in their control. How are you burning it? Calories is all about in and out. So if you are taking in some 100 calories, you have to burn 100 calories. If you are not burning, you are going to accumulate the fat. It goes and turns
Correct.
as a fat. That is one thing. There is something which some people are very disciplined, but still they're not losing weight. That's what
Exactly.
you asked about it. So there is something mistake in their BMR that is called basal metabolic rate. So whatever they're taking in, it is not getting burnt. So some part is staying back. That can be because of many reasons. One is the lifestyle, one is the food intake, one is sedentary habits, eating food while watching TV or screen time. And it can be because of diseases like hypothyroidism, PCOD, which is very common in young girls. Papa, they try everything, but still they don't lose weight. That's one thing. And there are so many other diseases like Cushing's and all adrenal issues. Still they don't lose weight. And what I see in more common is this PCOD is ramping up in young women. So what happens is, if you really see the data, 1 out of 10 adolescent women, or what is happening, 1 out of 10 adolescent girls are having this PCOD problem. What is PCOD? Basically, PCOD, there are a lot of cysts around the ovary, which will increase your testosterone, reduce your estrogen, and a lot of hormonal changes happen in this process. In this process, what will happen? A person put on a lot of weight. Even though they try to lose weight, they don't lose weight so easily like a normal person. The BMR goes down for them. So, what is BMR is? The burning rate of the calories. So, goes down. So, even though they are eating less, whatever calories is going to get deposited there. So, obesity, I feel it's a multifactorial issue. Not one factor causes obesity. Some patients are very disciplined, but still they gain because their genetics. The parents are obese, the grandparents are obese, the father side obesity is there, which transferred into the genes and inhabited in them. Even though they're disciplined, they keep on gaining weight. Genetics, I feel, is the number one factor for obesity. Because if you really see my clinic, I place a lot of sofas because the whole family is obese. So they can't fit into the chairs. So I made sofas so that the whole family, mother, father, this, everyone is obese. And the whole family sits together. Genetics is one of the reasons, PCOD, diseases, and so many more factors. If you really see nowadays, stress has become a very common thing. For example, when you take stress, the cortisol increases. The adrenal sitting on the kidney, it's a gland sitting on the kidney, will releases hormone called cortisol. This cortisol will deposit fat everywhere.
Okay.
That's the reason stress will cause obesity. So there is something called improper sleep. See, when you sleep now, the repair mechanism happens for the body. When you don't sleep properly, you're stressed out. Again, you deposit weight. So sleeping well causes weight loss, not weight gain. So a lot of things around it. So it's a multifactorial issues.
Talking about pediatric surgery, it's honestly not something I know much about because I've been a little scared of this word. So I know the surgery has been famous in the last few years, or many years for that matter. But there are many rumors, myths around it, probably, or I don't know what's the fact. It sounds a bit scary to be honest, because it is a surgery that's supposed to, work on your stomach, reduce the size of your stomach, is what I've heard. I honestly want to know, doctor, how safe is it? Because I have heard of different stories by different fat procedures, removal procedures. People have, had health issues, lost lives, etc. So I honestly want to know how safe this
Yeah,
surgery is. How is it done? And how long you need to recover from this if someone does it?
yeah. So there are a lot of myths. The number one myth is it unsafe? What happens is any surgery comes into the market, it takes some time to establish its safety.
Correct.
For example, any product comes, it takes some time. Over a period of time, the safety is established, people will opt for it.
Correct.
Initially, scare. For example, COVID vaccine also. Initially, it came, so people are reluctant to take vaccine because that scare what will happen to take vaccine. So any surgery, for example, this surgery has taken almost 20 plus years to come into the market. It came 20 years before. Now, what happens is we are trained into this surgery very well, and we do day in and out this surgery. So when you do the same surgery again and again, the precision, the quality of the surgery, the quality of outcome, the safety of the surgery increases. That's how it is. Maybe the word scary has been 20 years back. Now, people is as well established. We have done a lot of patients roaming in the market. So it's become a good thing, like they're losing good amount of weight, and it's become the safety has established over a period of time. So if it is done correctly in a center like Manipal, which we do, so if it is done by us, because we are trained into it and with a good equipment, good infrastructure, definitely the safety of surgery increases. Number two is a lot of people think it's a liposuction. No, liposuction is different. Obesity is different. Obesity is for the people who are 40 plus BMI. For example, the people are very obese. They are not losing with other conventional methods like diet, exercise. We do this surgery. This surgery helps them losing 40, 50, 60, depends on their, till 100 kgs, they lose weight. So what I mean, it's a completely different transformation happens altogether. A person before he was unable to walk for short steps, now he can walk for 8 kilometers. We have patients like this. A patient who was unable to sleep normally without snoring, he's sleeping properly. A person who is having uncontrolled diabetes because of obesity, now his diabetic medication has calmed down. The elderly people who are unable to walk because of obesity, they are unable to walk. Once they lose weight, the pressure on the knees comes down. The knee pain comes down for obese people.
Oh, I didn't know this. So apart from losing weight,
Yes.
looking better, feeling better,
Yeah.
it can reverse your diabetes
Yes.
and a lot of other health issues,
Correct.
even the PCOD.
Yes, PCOD. They are all called metabolic benefits.
Okay.
That's the reason bariatric surgery nowadays it is called metabolic surgery. Metabolic benefits. Diabetic resolution is a metabolic benefit. Cholesterol, hypertension reduction is a metabolic benefit. So they're all metabolic benefits, so metabolic surgery.
Okay. How long does it take to recover? Like
Yeah.
today you do a surgery. By when can you get back to work and how much rest do you need?
Yeah. Surgery duration as such, maybe half an hour to 1 hour, or
Okay.
sometimes 1.5 hour, the surgery duration. Within 2 hours, I make them walk. There is no bed rest. It's a keyhole surgery. We put a small keyhole in the tummy and do the surgery. It's all keyhole surgery. Patient will be walking within 2 hours. Next day, I discharge the patient.
Next day they discharged. Oh,
Yes.
that's pretty quick. Okay.
That is called fast track surgery.
All right.
Less than 48 hours, everything is hospitalization, discharge, and everything. Check in, check out, we call it as in hotel language. Check in, check out happens in 48 hours. And what happens is within a week, he can join back his work.
Okay.
That's
That's
so
nice.
fast it is.
Are there any like complications post surgery by any chance? Like any kind of complication or any difficulty that you face when you're trying to recover, or any possibility if the surgery is done well?
Yeah.
Is there any possibility of anything going wrong?
Yeah. Any surgery has complications. Any
Okay.
surgery.
Okay.
Anything. The training of a surgeon, the equipment, the hospital like Manipal, we do the surgery, which makes the surgery safer.
Okay.
So if you really see this surgery, the complication rate is 0.5 to 2%.
Okay.
Still 98% safe.
All right. Okay.
Understand, right?
Okay. Yeah.
But what happens is with the so many checklists we are doing in Manipal Hospital, even the 0.5 to 2% complications also reduce slowly. Understand? I'm not saying I'm completely complication free, but the complications are very less with our surgeries because we do it every day and we do with high precision.
Okay.
That's it. And whatever they say, for example, if you even go for a simple gallbladder surgery or uterus removal surgery, you will have complications. Correct, right? It can happen to you also. So, but the thing is, by doing it in a safe way, we can minimize the complication. That's what I want to say.
All right. Okay. So yes, of course, the surgeon and the hospital really, really matters because
Correct.
that makes a lot of difference. Okay. Now, do you have like patients from all over the world
Yes,
or just India? All over the world.
all over the world.
So now they come and do a surgery. Like, when do they go back? And after that, how do they keep in touch with you?
Yeah.
How do you take care of them after surgery? Because that's also
Correct.
important.
Correct.
Till they are completely fine, 100% fine. How do you take care of them?
There is something called medical tourism. Okay. Just like you do tourism outside, the medical tourism is something where a patient travels from different parts of India and abroad
Okay.
to a particular city. For example, this is Bangalore. Patient can come from Mumbai, they can from Gujarat, they can come from Delhi, they can come from Middle East, Saudi, Dubai, they can come from UK. We have patients from UK also.
Oh,
So
amazing.
what happens is the safety matters for anyone. If you do a surgery, safety matters. They travel here for the safety of the surgery because we do it in a safe way. So after doing surgery, post surgery, that is very, very important. I should know what they're eating, what they're following, they're taking protein or not, they're taking multivitamin or not. In that process, what I do is I started a WhatsApp groups, different WhatsApp groups where I add a lot of patients into the group who underwent the surgery. And in that WhatsApp group, there are previous patients also who underwent 1 year back, 2 years back. And I'm there, my dietitian is there.
Okay.
So any small query they get it, they drop the message in the group. So the old patients will take care of them because they already went through the same process. They take care of them. If it is not possible with them, me or my dietitian will answer the queries. So in that way, I'm in touch with them. So I'll be knowing how much they lost, how much they're maintaining their muscle mass, and how are they maintaining the protein requirements. They're meeting the protein requirements or not. How are they maintaining the multivitamin requirements? And I want them to lose in a healthy way
All right.
without
Okay.
having much loose skin.
Okay. So that's nice. I mean, that's
Yeah.
the way you can keep in touch with them, and
Yes,
they'll also know about what the others went through and
correct.
everything.
And
I
it's
think.
like one more thing in that group is
Mm.
because when a person does a surgery, for example, a special surgery like bariatric surgery or anything, they shouldn't feel that they are the only one who has done the surgery.
Okay.
If you add into the group, oh, there are 100 more, 200 more who are done with that, 500 more. Psychologically, they feel better.
Okay.
And the patients who have already underwent the surgery 2 years back,
Mm.
these people will give psychological motivation. Oh, chalo, don't worry, chill यार, मैंने भी ऐसा ही face किया था, आप भी face करोगे, but it will get better over a period of time करको.
Okay.
So in that way, a lot of psychological, emotional support also get in the group.
Okay. So now, what's the kind of age group that most patients are from? Like, are they more men? Are they more women? And do you have to be a certain age to do it? Like, for example, is it unsafe if you're above 60 or 70? Like, I mean, is there an age group which is perfect for the surgery?
Actually, to be very frank, the age group criteria has gone nowadays because
Okay.
even this is the childhood obesity.
Mm.
You see 10-year boy is very obese, 80 kgs, 70 kgs. You see elder man who has neglected obesity in early stage, landed up in 120, 130. So there is no age group for obesity. So we don't consider any age groups for surgery, but we always keep it safe, 16 years plus kind of age group. So the reason behind is the minimum age why I keep 16 years is till 16 years they are mentally prepared what to eat. They're conscious what to eat. If I say something, they'll follow it. If they're young, 10, 12, they may not follow. That's the whole thing. So I get two group of patients. For younger people, the criteria is they should look good and they should get married. They should conceive naturally. So other way is the 50-year plus group where for them, it is not the looks. For them, it is about health. They're unable to go to the washroom. They're unable to get up. So those kind of patients, definitely.
So, I mean, like, is there a age limit for it? Like,
no age limit,
no?
to be very frank. If the heart and lung is good, if the patient
You'll
is
heal at
well
any
oriented,
age?
if they should be psychologically oriented.
Yeah.
I have done a patient who is 75-year-old, a woman. She's doing well. She was unable to walk properly. She came in a wheelchair. Now she's walking. Whenever she comes for follow-up checkups, she comes walking to my
That's
OPD.
so
That's
that's so
really,
amazing.
it's a big
That's
achievement
really
for us.
nice.
Yeah,
I just want to know what exactly happens in this procedure.
yeah,
Like, in the sense, I know liposuction is about sucking out fat from the body.
correct.
So, the same way, what is bariatric surgery about?
Liposuction is a body contouring procedure. You have found excess fat in the hands, legs, thighs, butts, abdomen. They remove the fat below the skin. But bariatric surgery is not. Bariatric surgery is a weight loss procedure
Okay.
where I put small holes in your tummy with the help of camera. I reduce the size of the stomach. Before you will be eating this much. After surgery, you can eat this much. But instead of eating 3 times, you can eat 4 to 5 times. The quantity is reduced.
Okay.
Understand, right? So basically, I reduce the size of the stomach and join with the intestine. That is gastric bypass, which I do very commonly.
Okay.
So where the food will not travel into the major part of the stomach, go into the intestine. So it takes a short route. So the capacity will be less. Even if you eat less, the hunger satiety happens. Satiety means you feel full.
All right.
Even if you eat this much, you'll be full. One is the quantity has come down. Number two, it doesn't go into the part of the stomach which has hunger hormone, which has craving. So patients will feel less craving post-surgery.
Okay.
Number three, the metabolism increases. So basically, the surgery increases your BMR, basal metabolic rate. Burning capacity increases, which is reduced in many obese patients. That is the reason for obesity.
I saw your, photos or reels, some before after,
Yeah.
where someone's this big and they become really this thin and all that. How long does it take to get that change?
Acha. So on average, I can say 8 to 10 months.
8 to
it
10 months.
takes.
Okay.
But the surgery is done only once. Many people think it's settings, multiple settings. No, it is only once. Surgery is only once. It's just half an hour to 1 hour, I said.
Okay.
After that, they keep on losing gradually. For example, some weight in first month, some weight in second month. Like this 8 to 10 months it takes to lose weight completely. I mean, whatever extra weight. For example, I am 120 kg. I should be 80 around according to my height. So I am 40 kgs excess. To lose that 40 kgs, may not lose 40, maybe lose 36, for example. If that weight loss happens in 8 to 10 months
Oh,
post-surgery,
okay.
gradual.
Even if somebody was really obese, even then, even if somebody was like 200 kgs plus and everything, they still lose weight in 8 to 10 months?
Yes. Maybe what happens is, this is a time where the BMR correction happens
Okay.
post-surgery.
Okay.
So they keep losing weight, but the quantity of weight losing them is different from what for example, a 120 kg may lose 36 kg, but a 200 guy may lose 80 to 100 kgs. Understand, right?
Okay.
The amount of weight losing is different,
Okay.
but the duration may be same.
Okay. So whatever age group they are from,
Yeah.
like even if there's somebody young or like
Yeah.
the 75-year-old that you're
Yeah,
speaking
yeah.
about, they
Yeah.
still lose weight and their metabolic
Yes.
rate is different in 8 to 10 months.
Yes.
Oh, that's quite cool.
Yeah. Shortcut.
Oh, that sounds very interesting.
Many people ask me this shortcut. I say it's not shortcut, it's a perfect cut. So
Okay, I have like two other questions. See, is there actually any pain post surgery? Like, I know
see,
it's keyhole, but
I know.
still
Yeah. The little pain will be there for a day.
for a day. That's it.
Yeah. The reason here is we put CO2 inside the abdomen, gas inside, and inflate the abdomen and do it. Surgery. The gas absorption happens in 24 hours, 28 to 48 hours.
Okay.
As the gas absorbs, the pain comes down. So that's the reason we see many patients are very active next day. If they have pain first day, next day, the pain percentage is almost 50% less or 60% less. So some people are ready to go home next day itself.
Okay.
In fact, many people
Okay.
like that.
But after that, they're fine. Like in
Yeah.
a week and all, they're fine.
Yeah, they're fine. That's the reason I said now.
And if they have to start exercise or like start
Yeah.
working out, how long?
Initially, brisk walk is okay for 1 month, 1.5 month. After they can join gym, they can do workouts, they can do the bodybuilding, whatever process. But it should be slow and gradual lifting of weights.
I know it's a keyhole surgery, but is there a chance that there are any scars on the body and stuff?
I put a small, like 5 mm to 1 centimeter holes. But that the tissue reaction is different for different person. I feel a very fair person may not have much scar.
Okay.
For Indian skin, little line may be seen.
Doctor, you're
Yeah,
known for operating on super obese people.
correct.
So, how are these cases different from the normal patients?
So super obese patients, I mean like 150, 180, 200, 240, like this patients. So imagining about operating them is not easy. So what happens is we have a specialized team who can evaluate those kind of, because I'm getting a lot of patients like this because
Okay.
my my reels with the super obese patients have become viral.
I saw one.
Yeah.
That is
So
pretty cool.
yeah. So what happens is one reel got 25 million views, one reel got some 15 million, 3 million, like this. We got some 8 to 10 reels which got so many million views. So then after seeing those reels, a lot of people are walking into my OPD, they're very obese, 200, 210, 220. So those kind of patients are slightly different from the patients which we operate regularly, like 120, 130 kind of patients. Because for them now, what happens is those kind of patients will have lot of thick fat mass in the abdominal wall.
Okay.
Because we put small hole and put a trocar, right? It's not easy for them to put a trocar. So what happens is we prepare them in different ways. We start them early liquid diet for a week or two. We optimize their oxygen CO2 levels. Who are snoring, we put a BiPAP machine. We give them respiratory exercises. So that what happens is you would have seen in the hospital, some patients will be doing ball exercise, blowing exercise where the balls
Correct.
lift.
Yeah.
So
Yeah.
that increases your lung capacity. That's how you increase your lung capacity. So before surgery, it's like a preparation. So before going to war, you prepare everything. Right? So similar way. So some patients require nebulization. Some people requires antibiotics and cough syrups to optimize the cough. And some patients require diuretics. We'll have a lot of edema on the abdominal wall, legs and all. We give diuretics. So in that way, we take clearances from all the pulmo, cardiac, and everything. So that's the reason the checkpoints and all will be taking care of the rest of the things, the thyroid status and all everything. So in that way, we optimize the patient and we do the surgery. And most of our super obese patients did well. They are doing very well. Even our 250 kg guy, 240, 230, they're all doing very well. So in that way, I think we are getting more popular in that super obese category.
So, what's the highest weight of a patient that you have operated on?
I operated is 248 kg.
All right.
Mm.
Okay.
So a lot of other challenges are there. A lot of more heavier than them are approaching me.
Oh
Like
my God. And
recently,
you're going to take them up.
yeah, recently 280 kg guy approached me. A recent 338 kg fellow approached me.
Oh.
So by seeing those reels, I think a lot of obese patients are approaching us. And one more thing, what is different for Manipal to operate this kind of super obese people is we have operating table which can bear till 400 kg.
Okay.
Till 400 kg we can operate. Those
Okay.
table can bear.
Okay.
Usually the operating tables will be bearing till 150 on average.
Okay.
Our operating table is can bear. And we have a 4K camera system where the image is very big and the precision depth of the vision is good because we see in the camera and operate with the keyholes. So what happens is the vision should be good. If the vision is good, the complications will be less. Understand it? If it is clear to view, we can operate well. And one more thing is our anesthesia team. They are well prepared to give anesthesia to any patient.
Okay.
So that's a boon for us.
Okay. I have another question.
Yeah.
Like, are there certain people who are not allowed to do this? Like, for example, if they've gone through some surgery, maybe pregnancy, maybe some other, maybe a liposuction. Are there any candidates who are not perfect
Yeah.
for this surgery or anybody who should not be allowed to do this?
Yeah. Pregnancy is not an issue. We can operate. If they have underwent 100 surgeries, also no problem. We can operate.
Oh, great.
If you have underwent many cesareans and all these things, so we can operate. But
Okay.
some patients are not medically fit from the cardiac point of view, pulmo point of view. Those patients we avoid. And some
Okay.
patients who have some special condition called Cushing syndrome,
Okay.
we try not to operate those kind of patients. Some healing issues the patients will be facing. Those kind of patients we avoid. Otherwise, number of surgeries doesn't matter. If they've underwent any other surgery, prior surgery, we can still operate.
Okay. So you do a checkup before,
Yes.
okay, selecting the patients.
Yeah.
Doctor, everyone's been now talking about these weight loss injections that we have all heard of. We are very, very curious. I'm very, very curious uh, on how this works. Are there any consequences? Is this a replacement for the whole weight loss procedure?
Yeah. So actually, before knowing that, we should know that for whom we can use this.
Okay.
So weight loss injections are used for the people who are ranging between BMI 25 to 35. Not
Okay.
for the people who are super obese or something like that. First of all, that is the main. Number two is weight loss injections reduce the motility of your gut. The food stays there for quite a long time, so you feel full for majority of the time, so you don't feel like eating. That is one thing. And the other effect of the weight loss injection is that will make you send a signal to the brain that you're full. Satiety, you feel full. This is the thing. So any injection or any tablet or anything comes with some side effects, especially the side effects like GI side effects like nausea, vomiting, and we see very commonly constipation for those kind of patients because food is moving at the low rate. So constipation is one thing, especially in people who are 50 years plus,
Okay.
where the GI motility is already less. And there are some links like pancreatitis, vision loss, and thyroid malignancies. These are the linked with weight loss injections. So yeah, we can use weight loss injections. I feel weight loss injections should be restricted for the people who are between BMI 25 to 35 and who are having diabetes along with weight. Understand, right? For them, it may help little bit. And we never know what are the long-term side effects of these injections. That is the main problem. So the problem here is the injections still you take, you may lose some weight. But if you discontinue, you're going to gain back.
Oh, so it has to be consistently taken?
Consistently taken.
Oh, I didn't
But
know
the
this.
problem here is it should be long term. For years together, you need to take. But what are the long term side effects?
Side
Nobody
effects.
knows
No
about
one
it.
knows. It's a new thing.
What's the difference between weight loss injections and surgery is
Hmm.
surgery can be used for super obese patients or obese patients, very obese patients.
Hmm.
And they lose, and the gaining back is not like weight loss injections. Understand, right? They lose and maintain it with the surgery. With the weight loss injections, once you stop, there is a chance that you may gain back. And you see a lot of reports which says that gaining back is very common entity once you stop the weight loss injections. So people should smartly opt it. If they are obese, very obese, you should go with the surgery. Understand? That's a permanent way. It is temporary.
There's another question I want to ask you from your answer.
Yeah.
So, has anybody regained weight after doing bariatric surgery?
Yes. But the percentage is very less.
Okay,
I feel the percentage is 5 to 10%.
5-10%.
Maybe not because of the surgery part. Maybe because of, I think, the discipline. They didn't maintain the discipline.
Okay, but
Post
then
surgery.
if they're going to feel full and your stomach is smaller and everything, why are those people still regaining the weight?
Yeah. Whatever I'm saying is in a long term, after 4 years, 5 years.
Okay.
So the whatever stomach I make small, because at the end of the day, it's a muscle which will stretch. The capacity may increase. That time, you should be conscious about not taking sugar, sweets, and bakery items and cola, Pepsi.
Okay.
If you maintain that discipline, you will not gain.
Okay. Okay. Got it. Okay.
So it's very clear. Weight loss injections or tablets or any other thing is temporary.
Mm.
Surgery is permanent.
Okay. Got it.
So no comparison between surgery and injections. Permanent and temporary.
Again, as an actress, I would like to ask you another question. How good it is for people from our industry or somebody who wants to be an actor, probably someone who is obese or on the heavier side and who wants to get into acting, or someone who's gained weight with age or whatever it is. So, first of all, of course, I do not want to know any names, but then are there people from our industry going through this procedure? And is this what is commonly
See, I'll tell you one thing. Irrespective of any industry, people are undergoing.
okay?
There are a lot of people in film industry who are undergoing surgery. A lot of people in the lawyers, police, doctors. Being a doctor, I operated so many doctors. So obesity is no exception for anyone. If you have to lose, you have to maintain, then surgery is the only way. And many people have done that. But the only thing is they have that stigma not to disclose it that they have done it.
Got it.
So because I feel their fans will feel disappointed. So our
Correct.
favorite actress has taken shortcut. So maybe that's the thing I think that is making them fear that not
Yeah.
disclosing that point. And many people think like surgery is a disability kind of thing. Is done surgery, oh, surgery is done. Maybe the life will be reduced.
Oh,
They,
that's another question I want to ask.
they think like that.
That's another question I want to ask.
In
By
fact, it's
any
reverse.
chance, does it reduce, what does it do to the lifespan? Any impact
I'll
on
tell
it
you
because
one
of
thing.
this?
I'll tell you one. I will tell a simple example. If you carry 2 bags, how far you walk. How far? For example, how much far you walk? 1
With 2
kilometer?
bags?
1 kilometer?
Depends on the weight of the bags, but
Oh, okay. Moderate weight bags.
yeah.
1 kilometer.
Mm.
If you reduce 1 bag,
You'll obviously, yeah, walk more. Yeah.
reduce 2 bags.
You'll run.
Hmm. So the life is like journey. The distance is journey.
Okay.
So basically, I'm reducing your weight or luggage, whatever it is. So what is going to happen? With a common sense, definitely the journey is longer, right?
Okay.
The similar way. If you shed weight, you live long.
Oh, so it increases your lifespan.
Obviously.
That's quite.
That's a common sense thing. Correct,
that's
right?
Quite nice. That's quite cool.
Correct. That's
Oh,
what.
That's amazing.
It's a misconception.
Okay. No, because some of us have
Yeah.
this fear.
Yeah.
Oh my God, if you go to a surgery, something is going to happen to your organs or your lifespan and all that. But yeah, probably it's just again a misconception. Yeah.
Correct.
Okay, that's great. Okay. So I think I asked you a lot of the questions that I really,
Yeah.
really want to know because honestly, I knew what this surgery is about in a very, very basic format, but this is the most that I've ever known. And I'm so
Correct.
glad that I could connect with you and get to hear from you, who is one of the most known surgeons in the entire country
Thank you.
and working with the reputed Manipal Hospital.
Yes.
I'm also a proud student from Manipal University.
Yeah.
So yeah, it's lovely talking to you, and I think this session would have debunked like a lot of misconceptions and a lot of fear that people have been having in their head about this. So I think if someone has a medical issue which is stopping them from their regular happy lives, they should have the strength and courage to go ahead with
Yes.
a safe option like this surgery.
Correct.
Thank you so much, Dr. Moinuddin, because it's very important that I give the right information and the right guidance to my, fans and followers who really trust me. And it was very, very important that we get the facts right. And because it's about health, wellness, and longevity, right? So thank you so much, doctor. It was lovely, lovely chatting with you.
Thank you, Paro.
I hope you guys enjoyed the session. Remember always that with the right guidance and the right medical support, it can really, really change your life and make your life a lot better.